Jeffrey?
Hunter King, we talked about this.
I know, Master Woodward, but please, use my name.
You and I both know how unethical first name usage during an objective is. You know we could be banished, right?
Jeffrey, I'm not sure
Should fill up the flag? Yeah, I don't blame you. Don't know why the judge ordered you to represent a region this time.
Everyone I knew and loved were exchanged in the trade. I'm worried I'll find out who went against my sister.
I don't like this either.
Thank you for everything, letting me talk to you about how I feel. It has been an honor to be accompanied by you, my best friend.
I won't argue. Good luck, Veronica.
Jeffrey.
This is a B10.News Alert, where we discuss whatever o'clock always live. My name is Dawn Cornell, and on June the 11th of 2009, the President declared on that morning's public speaking that we are currently undergoing a swine flu pandemic, confirming the declaration by the WHO. Ladies and gentlemen, this is a time to pay attention. How do you know if you have the swine flu? How do you prevent it? How do you treat it? Everything you need to know, right here on B10.News.
Mrs. Diana Harris, can you
That's President Harris, thank you very much.
Sorry. President Harris, can you confirm the WHO declaration of the 2009 H1N1 flu?
Yes, we can. So our experts at the CDC have been putting the distribution and the spread of this disease on a centralized emergency operation and have recently reported to the World Health Organization, WHO, that the 2009 H1N1 flu is a public health emergency of international concern. We are now fixated on this disease because we are at risk of a global outbreak at this very moment. We will keep...
Any updates on the H1N1 flu status?
I do have the ability to speak for the WHO that we are now on phase 6 of the pandemic alert, meaning the H1N1 flu is spreading to other regions of the world, and we are now undergoing the effects of a pandemic. The WHO will send out safety precautions to avoid contracting disease, as well as the symptoms of the disease, to national news stations, who will send out the information accordingly. Now, do we have any other...
Today, July the 10th, 2009, was the day that information was finally sent to B10.News, where we, live, will distribute said information alongside two incredibly special guests with inside information for the currently alarming situation of the swine flu. And here it is, my beautiful, gorgeous live viewers, the primary cause of the swine flu, or the H1N1 flu. This virus strand is really an assortment of viruses from birds, humans, and, pigs, as well as strands from the H1N1 and H3N2 influenza virus. Strange thing is, it was only discovered in spring 2009, recently, and what do you know? Look what happened. Well, this is where our first important guest comes in with a few words to say. Please state your name, look at the camera, and tell our live viewers why you're here. How are you, viewers? My name is Dr. Jill Dartmouth. I'm involved in the study and distribution of information involving the H1N1 virus. It is a relief and an honor to have you here sitting nearby, Dr. Dartmouth. Welcome to B10.News. Now, I take it that you have a new collection of information to distribute to our live viewers? Well, as President Harris just announced, yes, we do. With the virus now being a global emergency, it is my job to spread awareness and not the virus. Yeah, fantastic for you to be here. So first question, my live viewers and I already know that yes, there is a virus, but how are we to have contracted the virus? Is it an incredibly specific and complex series of events? Maybe something to do with immunity? Just what are the routes of transmission and how infectious is the swine flu? Yes, very important question to bring up, Dawn Cornell. Thank you very much. Now, even though it is called the swine flu, you can't get it from simply eating pork. If someone is exposed to contaminated droplets from sneezing or coughing, someone has gotten the virus, as it is airborne and from person to person. You can also get the virus from touching a contaminated surface, getting it on your hands, and then smearing it all over your face. It's not very pretty. The reason that this virus can be consumable is that the virus can get into your nose and your mouth, and then it has to travel down your throat and into your lungs. And as for how infectious it is, Harris, I know that you just pointed out earlier, but this is not the typical influenza virus people get every year. This is a new virus. Unlike the typical influenza disease, which does have a vaccine or some familiar immunity to prevent it from getting sick and infecting you, we don't have a vaccine for this new disease that's currently on the rise. With the fact that this is a version of influenza, one of the most infectious diseases of the modern world, I would definitely say that this is dangerously infected, with the RO value being between 1.4 and 1.6. And by the way, those that work in veterinary or in swine farms, just anywhere where pigs are nearby, have a greater risk of exposure due to the presence of pigs. Live pigs, I mean. That is incredibly alarming, since there are only so many of us. I'll definitely be careful for the sake of myself and others. You live viewers should too. Now on to the topic of transmission comes my next question. I don't want the swine flu, and I want to make sure that I don't get the virus. How can I avoid getting infected? Are there medical preservatives? Perhaps simple safety measures that can help me?
Well, yes, of course there are. I mean, the first and foremost preventative measure to apply to yourself is to get your vaccinations for typical flu viruses. Now, don't expect total immunity from the swine flu. It's just incredibly helpful for those with weak immune systems. Also, hygiene and cleanliness is a critical factor for preventing the swine flu from contracting to a person. This includes washing your hands very frequently and in the proper way. No pressing on the soap and lasting for 5 to 10 seconds. I mean, a 20-second through under the fingernails, everything. And clean surfaces around you at all times as well, and make sure to never touch your face, especially on the eyes and the mouth. And use hand sanitizer occasionally if you aren't around a sink or somewhere to wash your hands.
And with many public places like schools and childcare facilities closing, hand sanitizers are definitely necessary to keep our live viewers and many others who work for a job or have a dog to walk and such safe.
Yes, that's exactly what I was getting into. Now, some small preventative measures include educating yourself and other children about the swine flu, and maybe adjusting yourself to a different lifestyle. I mean, this includes staying at home a lot more often, even for the whole time at least, since risking yourself and others by staying home a lot more often from the virus will decrease your likeliness of getting the virus. If done so, you also need to avoid large crowds and not go to large events like a concert, and especially if you're more vulnerable, older or younger or pregnant, There are also suggestions to adjust yourself to a healthy lifestyle by getting into more exercise, eating healthy foods, drinking more water, all sorts of stuff to boost your immune system. And personally, I would also agree that wearing surgical masks, especially when you've been diagnosed with the virus, when going out is a priority for you.
Wait. I've done my research too. And according to my resources, the CDC says that face masks aren't only unreliable, but don't work and don't have to be used when going out in public. Unless you wish to if you are diagnosed with the swine flu. Can you explain that to me and our live viewers, please?
Yes, the functionality of the virus is definitely questionable, since we don't understand how face masks work out there in the real world. So there are suggestions to focus on wearing masks, but personally, I still find them to be another feature of immunity that I definitely myself will be getting involved in.
Wait, what's going on?
Hold on, Dawn Cornell. I need to talk to your live viewers. Listen, I went through a lot of trouble just to time travel here. So, hey, it's yours truly. You really did hear Dr. Dartmouth right. I double-checked. I even triple-checked. Back in 2009 to 2010, back when there was a pandemic similar to the coronavirus, no masks were used. I even talked to my family members. Barely saw anybody with a mask. I focused on my memory. I don't remember anything about it, except one time where I had to wear a mask just to get to a flu shot. I have to address this, as nowadays, masks are my life, and should be yours too. I can't believe this either, so, but just remember, this is 2009, not 2021, as you usually know. So, double mask please, stay safe, my lovely live viewers.
Did we just capture that? Okay. I think I guess scientists need a moment to take into account what just happened, so...
Yeah, we'll give her a moment.
Okay, good. So, with her gone for a minute to question sciences entirely, we have our second guest who I hope is doing alright.
Check myself. Astounded, but doing okay.
Okay, good. So, please state your name into the camera and our live viewers, and explain to us why you were in this news alert today.
I'll be delighted to. Hello, live viewers. My name is Priscilla Ivy. Unfortunately, most of my family members, such as my mother, my brother, his husband, my baby cousin, and my rich aunt, have all contracted the virus. But since they're busy taking care of themselves, I'm here to speak for them and their experience.
I share a great big shame that your family is going through such a horrible and possibly painful experience. I do wish well for your family members, and thank you for being here too. And I know that deep down in her heart, Dr. Douglas does too. Speaking of experiences, our next question that live viewers would love and need to know are how to know when they have the virus based on what your family and the doctors have said. What symptoms have they experienced when they were being diagnosed?
The doctors and I actually just had to talk about this, but just as Dr. Dartmouth said, the swine flu is really just a brand new strand of the influenza virus, so the symptoms are ultimately flu-like. So, and there's a long list of it too. My family experienced fever, like headache, irritated eyes, and chills. There are also cold symptoms like cough, sore throat, stuffy runny nose, and vomiting. Sometimes there was body ache and joint pain, diarrhea. So for all of them had a general like malaise, I don't know what the doctor called it, and they overwhelmed them as well.
That's pretty scary. I can't imagine what they're going through. Thank you so much. So, see here, live viewers, if you have these symptoms, consider yourself as a potential problem. Speaking of which, are there any specifications to which you need to know about hospitalization?
Yes, for typical symptoms I just mentioned, a lot of people can get well when they're at home, they don't go out, focus on themselves to take care of, and then they are cured. However, those that have like chronic diseases or are pregnant or if you have a weak immune system and show these symptoms, it's best to call a doctor. The thing that everyone needs to stay alert is that there are emergency symptoms, like if you get them, get to a hospital right away. So they differ from age. Adults typically have confusion, seizures, breathing problems. There's also a severity of pain and dizziness. And as you can tell, those symptoms rely mostly on the respiratory system, so keep that in mind. The bad news for the children is that my baby niece, she's a small child and with asthma, and she almost had all the child emergency symptoms like difficulty breathing, chest pain, blue lips, shortness of breath, and even a seizure that made her asthma worse. Some of the children can get dehydration, high fevers, labored breathing, bluish skin color, unconsciousness, and irritability. There's also a severity for pain and flu-like symptoms.
Unbelievable that's happening out there right now. Now, of course, for every disease, there's treatment. Can you tell our live viewers some treatment options from this dangerous virus and possibly give a time frame for recovery? Maybe mortality rates?
Why, yes I can, because my family's doctor also told me this information. Again, at-home treatment is definitely very common. It might be treated at home by a doctor, but some people might have no treatment and full recovery, yeah. So, however, more serious and deadly cases require specialists for infections, respiratory, and critical diseases. At the time, the vaccine is still being developed, so as Dr. Dartmouth said earlier, get your typical flu shots. They hope. Treatment of now primarily focuses on the relief of the symptoms. Antiviral drugs usually given to high-risk patients, those that are hospitalized if they need it. There are also very specific H1N1 drugs that interfere with the release and replication and transcription of the virus. So, for smaller children, there are also oral doses or those used with an inhaler, since children can't take pills. However, an IV dose would be needed for infants who can't take oral or inhaled drugs. Wait, nobody understood what I just said.
Waiting for the day to announce the vaccine, am I right, live viewers and Miss Ivy?
You're right, you are. I will always be checking this news, like, you know.
As for the time frame of recovery, mortality rates, this is live, hurry on!
Oh, sorry, okay. So since mortality rates are pretty early and this virus is fairly new, we predict that the mortality rate will be very, very low. So the prediction so far is about 90,000 deaths per year, according to the president's given information. But it could be possible about 36,000 deaths per year. Only time will tell. As for time frame of recovery, I might have overplayed the symptoms, since a full recovery would be within a week, even without the need of hospitalization or medical care. But would definitely have a longer rate than most severe cases.
Thank you so much. Now you are welcome to stay here, but that is all the questions we have for you to ask for our live viewers. Now, hey, there's Dr. Dartmouth. Are you okay? Now we have just one more question for you about the virus. Are you able to provide us some statistics, maybe facts, any scale of the disease and the effect it has on global population?
Yes, thank you. I'm doing very well. Thank you very much. Now, can we just get to the map of the world? Okay. Thank you very much. So this is the map of the world, as I just said, taken just a few days ago on July the 6th. Happy 4th birthday, Claire Jennings, my favorite child star. Now, okay, I'm getting off topic. So these are cases and deaths that are reported to the WHO. As you can see here, the cases are pretty high around the West, but Greenland can't give us anything for some reason. So the reason why North and South America are the highest cases is because that is where the virus originates from, with the first case being in Mexico in March 2009. And due to the lack of immunity, since it's a new disease, there was bound to be many cases, and as clearly shown, many deaths in the US and Mexico. Global traveling and close contact with pigs and other individuals caused the incredibly contagious disease to spread globally, with countries with a high population being affected greatly, such as Spain, Australia, and China. Deaths currently count to 429. However, this is just the beginning, and we will definitely see some change in the numbers soon. Okay, can we get the statistics now? Okay, yes, thank you. This is the other collection of statistics. Altogether explains what I previously just said, that traveling and tourism were a great aspect to the global infections. The data leads up to late April 2009, where Figure 8 states how many confirmed cases reported on the 30th of April and how many passengers left Mexico around the same day. Figure B states the number of cases exported to a certain country, which includes the number of cases from Mexico and total number of cases on that day. So Figure C and D simply contain densities that I don't understand, I don't know. And Figure E is the number of acute respiratory infections cases per 100,000 inhabitants by state, which is demonstrating the distribution of the disease within Mexico. And notice that when people travel, cases start to rise, and the majority of spread cases originate from its origin country, Mexico. And apparently that's all I have today. Hopefully it wasn't too confusing.
Can't speak for my live viewers, sorry. Anyway, if you have any questions, please speak to whoever planned this live viewing of the swine flu. I especially want to thank my two guests for being here today, and I really appreciate the information you gave us. It will definitely be helpful. Take care of yourself, my lovely viewers. In 2009, we wish to give out our wishes for the pandemic, and if this pandemic lasts 11 years, we're gonna have a talk. I'm just kidding. That is the end of this news alert. Do you want to grant our live viewers a goodbye?
Of course. Stay safe. Listen to your doctor. If you have any symptoms, call a doctor. And if you have a computer, free to visit an article if you want any more information. Stay safe.
Hey dudes and dudettes, be careful out there. Don't take anything for granted under these dark times. Keep yourself clean, check for symptoms, and get your flu shots. Good luck out there. I'll see you soon.
Alright, this was the July 10th, 2009 news alert. I'm your host, Dawn Cornell, and this has been B10.News. As always, continue to wonder, my beautiful live viewers, and I'll see you next time. Goodbye. I love you.
She was laughing after all happened. I had no idea. Point is, Dr. King, the job is done. But that kind of loyalty over family is just... Jeffrey? Veronica? Get the gang. We need to talk. I've been waiting for you to tell me this. Veronica? I've made a mistake. Oh my goodness, no you didn't. Yeah, I did. Get the gang now. On it.